Good evening, everyone. I'm Jeff Glore with a Western edition of the broadcast. It's been 6 months since the open enrollment started. For both supporters and detractors, it may have felt more like 6 years. But tomorrow is the deadline. If you don't have health insurance coverage by tomorrow, the penalty could be a tax of 1% of your income or $95, whichever is higher. The healthcare website is reporting record volume this weekend. In some cases, callers can't get through. That even though one study says only 39% of uninsured Americans realize tomorrow is the deadline. With more, we begin with Mark Albert in Washington.
Okay, let's get you signed in.
It's a long sprint to the finish line. People packed health fairs in California's Bay Area. At a Miami mall, 8-hour waits.
Oh my God, I need to turn back around.
And in Silver Spring, Maryland, lines began before dawn.
We've given out about 100 numbers, and the building doesn't open for another hour.
Health official Mary Anderson brought in extra navigators this weekend to help people like Kate Kodak, who had hoped to avoid the last-minute lines.
I really didn't want to do this. I wanted to get done online, but I couldn't do it.
The administration is providing a grace period of unspecified length for the vast majority, those applying online or by phone. But a person must first attest they did try to sign up before the deadline. The government will take your word for it. It's on the honor system. The effort to reach everyone before the deadline has stretched from the pews to the pubs, where young people have been preached at, prodded, and pushed to sign up. Their monthly payments will partially subsidize the care of older Americans. But 18 to 34-year-olds, advocates found, have faced a steep learning curve, many not knowing basic health care terms.
Before you started this process, did you know what a premium was?
I did not know.
21-year-old Mohammed Munam waited until the last minute to sign up. In fact, only a quarter of enrollees have been young people, far short of initial projections. Industry analyst Dan Mendelson of Avalier Health believes health plans privately prepared for this, and that any higher premiums next year will be blamed just as much on rising costs and taxes as a lack of young people.
We expect to see double-digit increases in premiums on a going-forward basis, again, as a result of all of these factors. I don't think that the demographic mix is going to be a major driver of premium increases on a going-forward basis.
Despite the last-minute surge in enrollments, the key test will be how many of those who have signed up actually pay for their first month's premiums to keep the coverage. Jeff?
Mark Albert, thank you very much.